let's look at the typical pattern in a developing country. It kind of creates a negative feedback loop. If you've got poor health, that leads to family sizes being based on quantity. Large families lead to high population growth rates. A large population means increased demand for natural resources and a degraded environment, which can therefore then no longer sustain the population, leading back to poor health, and the cycle continues on. So in this pattern, you don't achieve your conservation and development goals. What Blue Ventures is trying to do is target all three sectors with the idea that if you have good health and family size is based on quality, families can be smaller, lower population growth, and less need for less demand for natural resources, leading to a healthier environment. And with a healthy environment, there are more natural resources that can sustain the population, leading back to good health. And in this approach, you do achieve conservation and development goals. So some of the benefits of this integrated approach, you can take advantage of existing partnerships and relationships. Blue Ventures had been working in the area since 2003. The family planning program wasn't started until 2007. And when it did begin, we were instantly able to go into all the various villages. We knew all the community leaders because we had already interacted with them to develop this, the locally managed marine area. We already had lots of different connections to NGOs working in the area, so we were able to take advantage of lots of good relationships and partnerships to quickly establish the program and get a lot of assistance and willingness to work with us because people already knew and trusted us. Also, one of the other benefits is you can reach larger audiences through combined messages. Through the family planning stuff, we mainly work with the women. The Valendrica Management Association tends to be more male-based, and so, but we can mix messages. We can, with the women, talk about the environmental stuff that they wouldn't otherwise be getting that message out to them. And they, when they're speaking to the men about natural resources and stuff, they can say, yeah, it's really important to keep population growth at a sustainable rate. And in order to do that, family planning is a really useful thing, and explaining the benefits of family planning to the men in the hopes that they then take this into their thinking when they're debating how to manage their natural resources. And it's also more cost-effective through resource sharing. We can share cars if we're going down places, or boats if we're going on trips places. You don't need to have redundant offices and everything. We do it all in-house. We've got one staff that does all of the different projects. So it also, taking this approach increases community buy-in because it generates goodwill within the community. There's been a heavy demand. We've noticed a heavy demand for these family planning services, and as we've provided it, it's generated a lot of goodwill with the community, and they've been more willing to work with us on all the other projects that we have going on. So a quick thing, it also serves to improve the effectiveness of conservation efforts, because all these reserves that we're building, if the population isn't kept in check, then the reserves are never going to allow the fish to recuperate to a level where they could deal with a population that's set to double in 10 to 15 years. So just some quick statistics. More than half the population of the region is under age 15. High infant and maternal mortality rates. The average birth rate, 6.7 children per woman, which is significantly higher than the national average of 4.8 and higher than the regional average of 6.2. With these stats, the population is set to double in 10 to 15 years, which it already can't feed itself as it is. So if they don't do something to stay in a more sustainable range, there will be a lot of undue suffering. So what we've done is set up some clinics. This is Andavadoka. The clinic there has been operating since 2007. We have, last year we opened a clinic in Befandefa, which is the commune capital. And we just recently, within the last 2 or 3 months, opened 2 additional clinics in the northern hub and southern hub within Valendrica. And We then have 16 community-based distributors. Each of these blue stars represents a community agent that we've trained to market a birth control pill and condoms. And so they've greatly increased our ability to distribute contraception throughout the region. These two red stars outside of Andava are the CBD supervisors. They supervise all of these community-based distributors. Every month they travel the region to check in with the other community agents, make sure they're not having any problems, report anything back to us, to make sure they have enough stock, and to deal with helping train them. And so this program has really increased our ability to get out to some of these remote areas and provide family planning options. These are just some of the medicines. We have 3-month, 1-month, 3-month, 3-year, 10-year options, and we get most of our medicines from Population Services International. They provide our short-term medicines, and Marie Stopes International provides our long-acting and reversible contraceptives, such as implants and intrauterine devices. So they've been very helpful in helping us improve access to these remote regions. We've also used a system of peer educators to go around and talk about the benefits of family planning, as well as about STIs and HIV/AIDS. We have about 14 of them who go around and have participated in theater events, community meetings, and some counseling stuff. And last October, we initiated something that's going to become an annual event, we hope. It's called FISA-able. FISA is actually how they refer to family planning there. It's the Malagasy branch of the International Planned Parenthood Foundation. FISA is, and so we just made a play off of it because it also means to play. So FISA-able was this big soccer tournament that we did in 3 villages. We got all the villages around those main hubs to come together, and at halftime we would have the peer educators doing talks about family planning. In the evening, we would show music videos interspersed with family planning messages, and have Population Services International also has lots of videos about where doctors are talking about family planning and so forth, and talking to locals about their use of it and their benefits. And so we showed these to a crowd of over 900 people. We had theater events where the peer educators were kind of showing the differences between a family that had 10 kids and a family that had 3 kids, and how they could afford much more easily to put their children through school and take them to the doctors. And we also gave contraceptives. We gave condoms out to all of the players with notes about STIs and what some of the symptoms were, because this region has one of the highest rates of STIs in the country. So just wrapping up some of the successes that we've had in terms of patient visits. In our first 2 years, we only saw about 500 people altogether. In our 3rd year, which 3 months before the end of it, we introduced this community-based distribution program. That number jumped up to almost 1,150. So big surge in patient visits. And in the last 5 months of this year 4, we've already seen almost as much as we saw in year 3 combined, in all of year 3 in just the last 5 months. So in total over this entire time, we've provided over 800 years a couple years of protection. So basically, if you think about one packet of birth control pills providing 1 month of protection, we've provided 800 years of protection throughout the region. That's a standard measurement for how effective a program is. Also, the contraceptive prevalence rate. Before the program started, 8.3% of the women in Andava Doka were using family planning options, 10.7% around the entire Velindrika region. Again, just with these numbers, Andava Doka, we've been working there for 3 years. The rest of Velindrika, we've been, in terms of family planning stuff, we've only been working there for the last year and a half. So there's been a significant jump, though. 42% of women in Andava Doka now are using family planning. We've been running a weekly clinic there for 3 years. That's kind of the base of our education efforts, and 42% of women are using it. So there's been a dramatic drop in birth rate there, smaller families, more people going to school. And so anyway, this compares, just to kind of give you some national comparison or regional comparison, Madagascar is broken up into 22 regions. The region that we are in, the average for that entire area is 11.6. So if you combine this, the Andava into the Velindrica average, it's about 34%, so well over the 11.6 average. Some of the challenges, though, that we've encountered are just there's a lack of education throughout the region, and so we're dealing with very low capacity people in terms of writing and reading, and so when you're trying to work with them to prescribe birth control pills, it's a little tricky making sure that they're going through all the proper protocols and doing it safely. And so we spent a lot of time. We've had trainings with them every couple months to ensure that they're able to provide this safely and up to standards. And then also just the people in the village working with them, a lot of them don't have any sense of how the body works. I mean, most have not gone to school. The average woman that we're dealing with probably has 2 years of education. And so just working with them to understand how the stuff works and why they should be, things that they need to be concerned about. And so it's been a challenge to kind of impart that basic biology understanding to them. So, and then also just the isolation. We're 9 hours north of the largest town in the region by nice 4x4. And to get to a lot of the places is a full day boat ride. And so that's also been hard to get information out to places and to get, if there is a problem somewhere, to get that referred back to us takes a long time. So anyway, working to try and improve systems. I actually just had a meeting last week with some people to look at using SMS messages as a way of doing reporting and notifying, because we just got cell phone reception in the area a couple months ago, which has made a world of difference there. So anyway, looking forward to some of the things we're just now starting to do. We have MacArthur funding now, which has allowed us to begin this community health program. We've been focusing on water, sanitation, and hygiene initiatives. We're going to be doing a lot of well improvements and latrine building and promoting water purification. Things such as Suro here is basically a chlorine thing. We've trained all of our community agents in how to treat basic diarrheal issues and how to promote hand washing and improve sanitation so that diarrhea isn't as big of an issue. 56% of 56% of visits to the local clinic have been for diarrheal issues. So it's the biggest issue around there. Our survey said that that's what most families are concerned about. And so we've just done that within the last 2 months. And we're starting a maternal and infant care program. We'll be hiring a midwife shortly to start doing trainings and provide antenatal services, and so and working with some of the traditional birth attendants to improve their skills. We're also broadening our scope to start working a little more inland. This here is Befandefa, the commune capital. If you look out this way, this is the Mikea National Forest, National Park. Newly established within the last couple of years, and we'll be moving into this area to provide services with a new grant that we've just received from USAID. And so this will also allow us to increase north and south along the coast to cover approximately 150 kilometers of coast, and so we'll be providing a lot more comprehensive coastal zone management. And again, that's courtesy of USAID. The UNFPA has kind of allowed us to kickstart and get this program really going within the last year. MacArthur has just funded us for the next 3 years and to continue our services and provide more of the maternal and infant care stuff. And USAID has just given us funding to begin introducing some of these water and sanitation, hygiene, addressing those issues. So that's kind of the quick rundown on what Blue Ventures has been doing.